Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis S. Scott with What's Happening in Birmingham today. I have the honor and pleasure of being with Dr. Yokanda Clayton of Alabama Regional Medical Services, ARMS. We're here at the Northern Health Center, and one reason I want to bring the doctor on today because ARMS is starting appointment-based COVID-19 drive-through testing this Wednesday. So Dr. Clayton, thank you for coming on the podcast today.
Yes, thank you for having me here.
Great, so tell us about this new service you are offering to the community.
We wanted to make sure that everyone could be tested for COVID-19, so we have a testing center starting on Wednesday the 13th where you call, you make an appointment, and we ask you a series of questions and get you scheduled to have COVID-19 testing.
Now, the question a lot of people are going to be asking is, as far as, do you have to specifically have coronavirus symptoms to come in, or anybody just really feels like they just want peace of mind, can they come in and get tested?
Well, our first goal is to make sure that people who do have symptoms and are people who are high risk are able to get testing. So those are people who have diabetes or high blood pressure or asthma or other diseases that make them more likely to get COVID. And once we're able to help them, if we have any additional slots, we can now help asymptomatic people as well who need to have testing.
Okay, can you explain asymptomatic, what that means in your opinion?
So there's some people who don't have any symptoms at all for COVID, but they still are high risk. They still have diabetes. They still have high blood pressure. They still have asthma or COPD, and so we want to be able to test those individuals as well. So we have our symptomatic people, but we also have those asymptomatic people that we also want to get tested.
Okay, so when they come in, how you all are kind of like logistically wise going to have it kind of lined up when they come in? Because I know I've seen a lot of them where people drive up, they stick the nose swab in, they drive off, things like that.
Right. Our testing is right along our main street on 30th Avenue North. You will receive an intake packet that has some information that we need to get from every person who comes through. And we will ask a series of questions again, and then they will go through the process of getting their test, where we do take a nasal swab, only one test per car.
Okay, so as far as when will they know as far as the results if they have tested?
For this round of testing, the results will be back in 3 to 5 days.
Okay, now do they come back here for any follow-up, or do you refer them to another medical?
We will reach out to every person to discuss their test results with them because we need to decide if they need any further evaluation or treatment.
Now, would they have to come in, or you just call them as far as they find the results?
For their test results, we will contact each patient. If they need to come in afterwards, we can see them as well.
Okay, and of course, the most $1,000,000 question is, how much does this cost?
It is not, we do not charge for the testing.
Okay, and just for people, just kind of give them an idea, where is the Northern Health Center, the ARMS, located?
The Northern Health Center is located on 2817 30th Avenue North in North Birmingham.
Okay, so for more information, what's the best phone number to call?
The best number to call is our main office line, that is 205-407-5600.
Okay, so Dr. Clay, any final thoughts you want people to know? Because I know, like, as the country is gearing more towards reopening, that people may start thinking that the threat level's going down. Mm-hmm. What would you like to tell the public, in your own words about, because you're on the front lines of this, to kind of tell people be mindful of the importance of still going to get testing and social distancing and all,
Right. All those things are very important. Even though the country is starting to open back up, we still have to be very careful. COVID is still here. It's still real. There are people that are still dying from the disease. So social distancing is important. Wearing your mask when you're out in public is important. Staying 6 feet away is important. Also, we know that for people who do have symptoms, we don't want you to wait too late before you go to the doctor to be seen, before you go to the emergency room. I think some people are afraid or have been afraid to actually go in and get taken care of when they need it. So we just want to be mindful of those things. The ability to now test asymptomatic people is really great because we're going to find people that actually have the disease and we didn't even know it.
Oh wow! Then I've been thinking about. I've been reading the news as well. Is that sometimes I guess some of the symptoms first start with the sore throat.
Everyone is different.
Yeah.
Fever,
Mm-hmm.
the top three are still the same.
Mm-hmm.
Fever, cough, shortness of breath. But it was last week that the CDC released also that people can have loss of smell or taste can be a symptom in addition to a sore throat that's also listed, in addition to some other things, muscle aches and pains they also listed as criteria as well.
All right, well, Dr. Clayton, thank you for coming on today. I didn't want to hold you too long for your patience. Y'all definitely come out starting this Wednesday. This is a free service, so you got no excuse, whether you have insurance or not, to come get this great service because it can come down to literally life or death.
That's right.
So thank you all for watching this podcast. Please check out what's happening Birmingham.com for more videos, and don't forget to subscribe to my YouTube channel. Thank y'all again. Have a great day. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.